No. It's with great pleasure that I introduce Dr. Claire Kendall, who's going to be speaking to us today about citizen-informed health system change. Claire is an associate professor with the University of Ottawa, Department of Family Medicine, and a practicing physician at the Bruyère Family Medicine Center, and scientist with CTLC and VRI. Her area of interest is improving the primary care delivery of people living with and at risk for HIV. So Claire.
Thank you.
Thank you.
And barrier of the snacks.
Yeah.
So I wanted today just to give an overview of a project that our team is working on for citizen-informed health system change. These are some of the acknowledgements that I should be putting up today for team members and my own areas of support. No conflicts of interest. So as most people know, our team is a team of diverse researchers, people with lived experience, trying to understand the gaps in care delivery for people living with HIV from a really primary care perspective. And this is a population of people who I have become passionate about as a template for people living with physical, mental health, cognitive challenges, social challenges, and kind of with the perspective that we can learn to take care of this population, we can learn to take good care of anyone. And what we're really understanding is that there are gaps in the comprehensive care needs for this population in Ontario and in Canada. So what our team proposed to do, as part of our 5-year team grant, we'd actually planned on collaborating with the McMaster Health Forum to develop, I guess, what's called a stakeholder dialogue. So it's a process that they've developed at their team, and I'll be speaking about that at the end. But what we then decided to do, based on some other methods they've developed, was really to make this citizen-informed. So we, a person living with HIV who's on our team, and I, and one of the leads at the McMaster Health Forum submitted a SPORE collaboration grant, and we're awarded that to build on the work that we're doing, had intended to do around stakeholder dialogue. I'm going to walk you through the different phases in a second so you'll understand what I mean. So the objectives of this grant were to bring together the best available research evidence on this topic about delivering care for people living with HIV in Canada. And then you'll hear this language a lot. So what are the challenges? What are the options for addressing those challenges? And what are the key implementation considerations? So that's what this basket of literature is supposed to tell us. We then package that up and layer onto it citizens' values and preferences. So bringing people living with HIV and affected by HIV together to understand what their values are and preferences are to address these challenges. And then to convene this thing that I mentioned called the stakeholder dialogue, where they bring health system leaders together to try and figure out how to address some of these issues and actually make policy change going forward. I'm going to walk you through the stages of the process for people who might be interested, because this could be something that might apply to anyone's research actually. McMaster Health Forum has done dialogues and citizen panels for a whole diversity of topics in Canada. So the first step is to consult with key stakeholders, and that's the stage we're at now. So we were awarded the grant, and this is the stage we're at now. So we've established a steering committee of a small group of us who are making sure that we get the question right. To do that, we're doing some background research, discussing it. So these are policymakers from across the country, both at the national, provincial, and more local levels, people with lived experience, and a few of the researchers on the team with, again, lenses in primary care and other areas. And we're going to be conducting, not we necessarily, but the McMaster Health Forum team is going to be conducting key informant interviews. So they go out to, so we've been helping to compile this list. They go out to people who might be in policy or research or people with experience or aid services organizations, et cetera, to really understand what the problem is, what are the true options for addressing it, and again, those implementation considerations. So they do this through a very iterative process, and they've got an established method to conducting these key informant interviews and bringing the information back. They use this information then to develop what's called a citizen brief. So they use the key informant interviews and the evidence base that's been developed, both the published and graded literature, to create these plain language summaries for people, for patients or citizens is the term that they use. And what they do with that is pull it together to the questions they want people to consider in the panels that they will be conducting. They then convene the citizen panel. So we're going to do this a bit differently. Our team has investigators in Manitoba, Ontario, and Newfoundland and Labrador. And part of the reason we pulled those particular provinces together way back in the day is that they reflect very different experiences of healthcare delivery for everyone, but also for people living with HIV, different priority populations, people who are at risk. So we're going to convene a panel in each of these 3 provinces, these 3 jurisdictions, essentially thinking more like West, Middle, and Eastern Canada. So we'll bring together 14 to 16 people living with HIV or people affected by HIV. And McMaster Health Forum has a way of pooling from a large database they have called Asking Canadians so that the panels will be adequately diverse. And we may need to play with that a little bit ourselves, just knowing the populations that we're working with to make sure we have adequate representation. And then they bring them together into 1 day off-the-record deliberations to talk about the citizen brief, to understand what the issues are, and to think about who in the health system might need to do things differently to address the needs that are identified by this population. They then use this to prepare a summary of the citizen briefs. So they actually do like a thematic analysis of the transcripts of the day to bring together participants' views and experiences on the subject, what are their values and preferences around care delivery, and again, those implementation considerations and challenges that might be arising that would be important for people in policy change to know about. And we're going to bring those data together at the provincial level so it can hopefully have provincial impact, but then again, create like an overall integrated summary for the stakeholder dialogue. They do have a very rigorous evaluation process embedded into their structures. So they do things like, it's in different phases, but they do things like ask people to rate the briefs and the panels themselves. They ask them about knowledge before and after the event. They actually ask citizens to rate their health system experience of living within the healthcare system. And then at the very end, they do some qualitative interviews to really try and get at the experiences that people had in participating in these and what their anticipated impact will be. The final stage is in 2 parts. So one that we wanted to bring forward just as our team was supporting action through knowledge translation. So we want to be able to publish these citizen profiles, these citizen panel kind of outputs in the public domain, having news items and infographics, working with our partners like Katie, which is sort of like a knowledge broker for people living with HIV, on our own websites, and to use them to develop some tools and resources that will target citizens in engaging research. So that was a key component of the work, is that we didn't just want to ask people their opinion, we wanted to learn more about engaging people with lived experience. So, you know, which is a little bit different from McMaster Health Forum, we actually have people with lived experience embedded in all of the processes and hopefully listening in and working with students so they can all be learning about this process over time. And then the final kind of the pivotal event is the actual stakeholder dialogue. So we bring together people from across the country. It's going to be national stakeholder dialogue who are really equipped to deliver change in this area. So they get the citizen panel brief, evidence brief, along with all of the summary of the literature to understand the issues. And again, they're going back to those areas of what are the challenges that are being faced, what are the major implementation considerations, and what can people actually be doing within their constituencies to drive change. What we're hoping is that this will create new opportunities for collaboration between patients and patient-oriented research and researchers. We're hoping to ensure that we have generated experiential knowledge from citizens within these processes, and so that policymakers can use this evidence from a standpoint of patient values and preferences, and lead to programmatic change in that area. We're hoping to achieve more citizen-informed health system change within the HIV sector. So HIV is an area that has had people with lived experience very involved in policy along the way, but this would be kind of a rigorous and established way to make that actually happen. And we want to use it as an opportunity to mobilize community knowledge by using our existing KT infrastructure, so that of our team, but that of many of the other teams we collaborate with. And I wanted to leave lots of time for questions, because this is really a new process to me, and I thought it might be of interest to others who are seeking to make their own research kind of relevant at the policy level. Happy to answer questions. And that's it. Yeah.
Yeah, back in stage 3, you mentioned that part of the process was off the record. So
Yeah.
does that mean that you won't include any written report, written summary of those
We don't
discussions,
identify
or?
any yet. So the actual discussions wouldn't be released, but there would be a summary that will be developed and that will be provided to the stakeholders. Because we want people to be able to speak honestly about their experiences without being necessarily being identified. Okay, does that make sense? Kevin?
No, that sounds good. John Levis is
Yes, correct.
work
Yeah.
right from McMaster, and I think it's good. The one thing it's challenging on this citizenship is that there's just so many different people out there, and you're taking a small sample. And I think the method for understanding the small sample is great. So how do you get that to have impact on everybody else? I think that's the piece that's really challenging, because they weren't in the deliberation, they weren't in the. So they're kind of like getting it like later, which I know that this is the reality, but I don't know what you think.
So you mean the citizens themselves?
Yeah, I'm just like, I think it's like really valuable, but it's only valuable when it's reaching larger numbers of people.
Correct, yeah. And so some of the challenges we perceive are the diversity of people who are affected by HIV, right? So making sure that we've got that representation. I think it's kind of neat that we're doing it rather than just one citizen brief. We're doing it actually in 3, so we'll get 3 different jurisdictions. And we have to really kind of push back on that and say that that was important. And it'll be really interesting, I think, to see what the issues are that arise jurisdictionally, and then how this national panel can actually address all of that, right? And that was another perceived area of challenge, although McMaster Health Forum has worked this way before, is that care is delivered provincially as well, right? Another challenge, kind of relating to your question, is that, and this has come up in sort of our early discussions on the steering committee, is that like the perspective that our team is looking at is the delivery of care for people actually living with HIV, right? So how do we optimize the care for this population? But the truth is that there's a proportion of that population who doesn't even know they're infected yet, right? So how do we include, not prevention, we're not going to look at prevention, but how do we include like adequate diagnosis in this overall process of health system change? So certainly some challenges that we have to think about.
Thanks, Claire. Just had a question about the stakeholder dialogue.
Mm-hmm.
Okay, and just wondering, you had mentioned that will be with people who can make change. Right? So I'm just wondering who you anticipate that to be, and is the dialogue a single event or is it a series of events?
The dialogue is one event, so it's kind of a culminating event when they've had a chance to talk to the citizens in each of the provinces, package that information, package the evidence. This is their area of expertise, so I'm relying a bit on faith that where they talk about, having had impact in this area before. Some of the people that we're looking to include, so it would be Katie, like the knowledge broker, because that's a really key component of citizen engagement. We're hoping to have someone from PHAC at a high level attend, either Teresa Tam or a delegate, and we're kind of inviting people a year out, so that and we kind of identify the hot people that we want to include so that they'll, and I think a lot of people actually at high levels in policy are familiar with this process now through McMaster Health Forum, so they're kind of engaged. We have a couple of provincial leaders. We're hoping to have an Indigenous leader, an Indigenous health delivery. People also very focused on primary care, right? Really trying to bring in that primary care delivery aspect. But again, some are provincial and some are become national. And then a few people with lived experience who've also had experience working in policy, right? So it's kind of a fine line there because we want people with enough expertise to help drive change, but we want to also get real people's perspective, as Kevin said. Does that answer your question?
Yeah, no, absolutely. So then, what sort of venue would you be looking at?
Oh, they host it at the forum. Yes, so they've got this beautiful room apparently, and they actually usually host all of their citizen panels and stakeholder dialogues there. And again, we had to kind of push to say we want to have them locally for the different provinces that we're working with, but they do it all.
Okay.
It's not cheap.
Right, so they're doing it, so you have to get scheduled in, I would
Yep.
imagine, right? So
Yep.
you have to know ahead of time.
Exactly. I mean, it helps that they are Mike Wilson, who's one of the McMaster Health Forum people, is a collaborator on our original team grant, and he's one of the co-PIs on this particular grant, so they're invested in making it happen. And then John Levis is also on the board of the Ontario Issue Treatment Network now, so like there's some engagement in this area that we wanted to kind of capitalize on while we can. Yeah.
I might have missed this at the very beginning, but I was just curious about the timeline for the.
Sure, so yeah, good. The grant's for a year, so we're trying to get it done within a year, and that's sort of their overall process, generally. So we're hoping to get all the work done so we can host this stakeholder dialogue, the final event, in May next year. Yeah. It's neat though. I think it'll be, maybe I'll try and present in a year on what we've found so that people can see what the actual outputs end up being. I think they've done about 60 of these, so they kind of have
wow.
yeah, it's a lot. They've got
Yeah.
they've got a whole workhouse. Yeah.
It's good.
Good. Yeah, it's interesting. Great, but not cheap. But it was a good opportunity to get a grant specifically to do this, right? I thought either they're going to let us do this or they're not. They may not want to, like CHR may not want to pay for this type of event. So I think it is something that other groups could build on if they wanted to. And that's it. Great.
Thank you so much.
Welcome. Thank you.